Hi everyone. For those of you who do not know me, my name is Crystal Cox and I am a first grade teacher at Richlands Primary School, and I live in a small community, namely Richlands, and I am part of the cohort with the counselor education at ECU, and I'm very excited to be able to participate in this course and hopefully learn a lot of new things about integrative health care and be able to find out more about this. Lord have mercy, help me with this word, rural. I have a very hard time saying it. My country accent sometimes gets in the way, so I'm very proud of it though. But that's just a little bit about me, and I am married and I have 2 children, and I have a 1-year-old grandson, and just really like to read and relax, at the beach a little bit here and there. But to move on about the PowerPoint and our first discussion for integrative approaches for integrative health care, I really do think an integrative health care would be very beneficial for patients. I think that if there's an integrative approach, that clients or patients would be quicker to get diagnosed or have less of an impact on their physical and mental well-being. I think also that, with an integrative approach, that really the patient and the healthcare providers, financial-wise, would be beneficial. When you go to a doctor, obviously they're going to pay some type of copay, and with a specialized doctor, you're going to increase the copay. I know, for example, with me, with my health insurance, I have a primary care provider who only pay a certain amount for. For example, it might be $30. Well, then, you go to a specialized doctor, such as a neurologist or endocrinologist or those types of people, then you would have a copay of $92. And so my point, though, being is if you have an integrative approach and you have that common connection with your primary care and your behavioral care person, you might not be more prone to go see someone several times, whereas if you have that integrative approach, it might not take that many times to try and figure out what a person is dealing with. And so therefore, cost is cut. If you don't have an integrative approach, the patient is at a disadvantage because they're going to their primary care person, they're getting seen for things, and then they're going to this doctor to get seen for different things. And, it's kind of like a domino effect. You go to A doctor and B doctor and C doctor, and you're telling the C doctor what the A doctor said, and you're telling the D doctor what, the C doctor said. And it's like you're just playing a domino effect, or, just ping pong back and forth. And the patient, poor thing, is in the middle of all this. But if you have an integrative healthcare approach and doctors can come across, it is easier for the patient to be diagnosed, I feel like, in a timely manner, to be able to figure out, which you can avoid, dangerous situations to where they don't have to end up in an emergency room or in an extreme emergency, because there were steps provided by all stakeholders to be able to figure out and how to help a patient. I think when you do an integrative approach, you have people who are a team of people, a team of support. And that's always a good thing, to be able to have an integrative approach, which means, I have this mental health doctor on my, team. I have my primary care doctor on my team. I have, this counselor on my team. And it's like a supportive network to be able to have for a patient when there is an integrative approach. I feel like that, the mindset behind having a integrative approach, it can be scary, it can be overwhelming, because it's like, what do we do in these communities in order to get this? And, it takes time and effort and organization skills to be able to put something like this together for rural communities. You know, in reading the article, I found one little section really, that stuck out to me, and I can't read it word for word because it was a big paragraph, but basically, it was that specialty medical settings, such as the cardiology or oncology clinics. They can horizontally integrate behavioral health services to address the stress, anxiety, and depression symptoms that usually go along with those types of clinics. In that example, it says those specialty settings, treatment for major depression might also be vertically integrated for a subpopulation in need of targeted services. Basically, when you have all that network of support working together for that patient, you have the nurse practitioner, the counselor, or this behavioral health person providing, treatment for anxiety or depression. When you have all those together, the end result is an optimal outcome, and that's one of the things that hit me. It says each provider thereby fulfills optimal roles for treating patients based on his or her area of expertise. And I really do think that needs to go to rural communities, because you all want the optimal outcome, and in order to do that, an integrated approach would be the best way to go. When you do, I think, have an approach such as the integrative approach for healthcare and the mental health field in rural communities, it does take time away from, people going out of town, taking off of work, going from one doctor to another doctor, and, just being able to see those physicians and the mental health counselors and all those, in isolation. Whereas if you have that integrated approach, hopefully diagnoses can, get done quicker. Medication can be given much faster. Hopefully, that's the optimal outcome, is to be able to figure out all these little things and put them together and see the whole picture of the patient. And cut their cost as well as the primary care and the behavioral health provider costs, for health insurance and health care. All in all, I think it's very beneficial to cut financial costs, to cut time. Patients have to be away from work, away from their children. And I just think, for a community to be able to have access to an integrative approach would be very, fitting. So I hope that we can learn more to be able to, promote integrative health care and these approaches for small rural communities.